back with another skills video. Today we're going to talk about gastric tubes or G tubes. They are used in order to provide nutrition to your residents and your patients. We have to do residual checks, and the purpose of the residual check is to see how well they are tolerating the feeding. And so what we're going to do is, we've already introduced ourselves. Of course, we've washed our hands, we've gloved up. I have my supplies here, everybody. I have a towel, I have my irrigation piston, and also the syringe that comes along with it. And this one has a Lopez valve. You may call it a cock stop. If you've never used one before, they're super easy. Right now we have it off to the patient so that their stomach contents don't come out. Once I attach my syringe and it's time to aspirate, to pull back to check the residual, I just need to turn the dial on the stopcock, and now it's off to the med port. And now when I pull back gently, I get to see how well my patient's tolerating her feeding. And so this would indicate to me that there could be potentially a problem. And so I'm going to show you how much is in the syringe. So now that I'm able to check the residual, and of course this is just a mannequin and this is not real life, but if this was a patient who just started their tube feeding and the rate was, let's say, 15 mLs per hour, this is 33 mLs. That tells me that my patient has 2 hours worth of food sitting on their stomach. They are not digesting the food properly. In most facilities, whatever stomach contents that you remove, you have to put back in. So let's do that now. All right, I want you to tell me what to do. Yes, I'm going to connect the syringe to the Lopez valve. And right now it is off to the patient. So if I try to put this back in, if I try to push on the syringe, it's not going to flow through. So what do I need to do to the valve? That's right, I need to turn it so that it is now on to the patient. And now when you're reinstilling, when you're putting the gastric contents back, you do so slowly. Miss Lucas, are you feeling okay? And there's some air in here. Your goal would be to not put the air in their body, because that's going to cause them to become gassy. So once I'm just going to raise my syringe. And that's going to allow that air to remain in the syringe and not be pushed into my patient's body. Now I'm going to have to turn it off towards the patient before I disconnect. For classroom purposes, the fluid that I used was a clear fluid. However, if this was a real patient, this would be something that could be milky. It could actually cause bacteria to grow. So you just want to flush it gently based upon your facility's protocols. And most facilities are going to say 30 ml. So she has 30 on her stomach, and that's not good, but I'm going to go ahead and flush. All right, so we're at 30. All right, and talk me through it again, team. What do I do? Going to connect. Right now it's closed to the patient. What do I do? I'm going to open. You're such great teachers. And what's next, team? Yep, push slow. And again, the purpose of flushing is to make sure that we keep this gastric tube patent, that there is no food or no medications that are stuck in this tube. And it also can be used to hydrate your patient. So if they're not able to consume fluids orally, we have to give them their hydration via the gastric tube. Clean up. Make sure you always check your dressing, and our dressing is intact. And team, that's it. You have did it. You've checked the residuals on your patient's gastric tube. Don't forget to lower that bed, give them the call bell, raise the rail back up on the working side. Don't forget to take off your gloves. We're going to take them off the proper way. We're going to pinch and pull down. 2 fingers under. Don't touch the inside. Discard your gloves, wash your hands. And so don't forget, you need to document. You need to document your findings. And so once your patient's taken care of, meaning that side rail's back up, the bed's down, of course, you've taken off your gloves and you've washed your hands, you want to make sure that you also document. You'll document the gastric contents, how much the residual was. And if you're concerned, maybe there's some gastric distension, maybe the bowel sounds are hyper or hypoactive, you want to be notifying your physician of that, because we probably need to pause that tube feeding for a little bit. And don't forget, get your patient out of bed. Getting them up, moving them around helps with peristalsis, helps to move those gastric juices, and to also help with them actually absorbing and digesting their nutrients. So everybody, this is Nurse Eunice. Sorry my voice is going out, but I'll see you in the next video. Look, we know that nursing school is tough. And now that you're a new nurse, it can feel like you don't know what you are doing. We've been there. Every nurse has. That's why at Florida Training Academy, we've created the Nursing Clinical Skills Lab, a safe place where new nurses and practicing nurses can boost their skills, build confidence, and thrive in their careers. You don't have to figure it out alone. We're here to support you every step of the way. Visit fltraining.com today and take your next step towards nursing success.